Hey, everybody. Dr. Ashanti here at Charles R. Drew University of Medicine and Science. I'm joined today with Dr. Noe Chavez, who's an assistant professor in our urban public health program and our psychology program, and he's going to introduce himself in a bit. But I just wanted to welcome all of you to our inaugural webinar in the Lion's Den. So, without further ado, I just want to give you a few remarks about CDU. Did you know that Charles R. Drew University of Medicine and Science, it's located in the Watts Willowbrook community? And did you also know that it was founded from the ashes of the Watts riots? Yes, you guys, this university was created to serve the community. We are a specialized university where we have programs in the Associate of Science and Radiologic Technology, a Bachelor of Science in Public Health, a Bachelor's of Science in Psychology, a Master's of Science in Biomedical Sciences, along with the bachelor's degree. We even have our own medical school, and check out our College of Nursing. If you want more information about Charles R. Drew University of Medicine and Science, check us out at www.cdrewu.edu. Let me give that to you again. That's www.cdrewu.edu. All right, you guys, you know how we do in the Lion's Den. Let's get the conversation started. I'm going to turn it over to Dr. Noe Chavez, who will introduce himself. Tell the people who you are, Dr. Chavez.
Thank you, Ashanti. So it's great to be here, and really am excited to be part of this conversation. So I'm an assistant professor in urban public health and in our psychology program, which has an emphasis in community counseling. I'm a trained community psychologist. And I'll share a little bit more later as we have the conversation, but my training as a community psychologist is a perfect fit with the mission of CDU, which is this, focused on social justice and working with the community to address issues of health equity. I'm not actually from South LA. I'm originally from El Paso, Texas. So I grew up at the border. I was born in Juarez, Mexico, and then grew up there at the border in El Paso, Texas, and Juarez. That my experience growing up at the border also really shaped my interest in doing work in health disparities and also, thinking of one's cultural identity and how that influences the way that we do the research and we work with community. Thank you.
I love it. I love it, Dr. Chavez. So let's get into the conversation. What is community psychology?
Yeah, great question. So community psychology, and I often find that not a lot of people know about the field, which is interesting. It's similar to, CDU, that sometimes not everyone is aware about CDU. And both share a similar history. So CDU started, 1966, I believe that was the first time that the university officially started. But then, you had, like, as you mentioned, Ashanti, earlier, the Watts Rebellion and people organizing in Watts for better healthcare, better access to healthcare and resources and opportunities in the community. That was sort of that period of time, around the time that the civil rights movement was happening in our country and around the world, really. Community psychology was born basically in 1965 as well. So it started as a field officially, at least in the US, in 1965. And I was at a conference called the Swampscott Conference in Massachusetts. And it was basically developed by a group of clinical psychologists that were disillusioned with the direction that the field was in of psychology and mental health more broadly was taking, and the focus was mostly at the individual level, and they felt that it was not really addressing the larger social issues happening in the world, and they felt that our mental health is really intertwined with our social context, and in order to really understand better how to support people with mental health challenges, we really need to understand this intersection of the social problems that exist in society and how that affects us as individuals, our development, our well-being. So really, the field of community psychology really has a similar history and impetus as the University of Charles Drew, and really, starting with this drive towards addressing issues of social injustice and improving our well-being, working with community.
Wow, I love it. I love it. Very much like, communities of color, how we come together and commune and talk, right? I love that. I love that, Dr. Chavez. So with some of our listeners who will be watching this webinar, even as it's being recorded, what does a community psychologist do?
So a community psychologist, given the complexity of everything happening in the world, and, when I just said there's a lot of different social issues that intersect with our mental well-being, with our development, with just our psychological, reality in general. Community psychologists do a lot of different things. They work in different sectors, different environments, they apply different methods. They focus on different research questions, and some of them are not necessarily just focused on research, but advocacy. A lot of community psychologists, given the nature of really trying to address issues of social justice, tackling issues of systemic oppression and racism, there's a need to, apply different approaches, right? So a lot of community psychologists are engaged in advocacy and activism, working in partnership with community organizations. As a matter of fact, I was part of a fellowship from my professional society, the Society of Community Research and Action, which is the professional society of community psychologists. That was a few years back, and I worked with two other junior faculty, and we developed a project called the Lone Community Psychologist. And that was part of the reason that us as community psychologists, we were the only community psychologists in the institutions where we were working. That was one of the reasons that we developed this. We wanted to understand how other community psychologists around the world, their experience in their work environments, and just to learn more about what the work that they did and their experience or journey as a community psychologist. So we interviewed actually about 31 community psychologists around the world, mostly in the US, some in Canada, others in Europe, and a few in the Philippines. And through those interviews, we learned a lot about, the diversity of different experiences that community psychologists have. Some of them work in the nonprofit sector, not with nonprofit organizations, some as community activists and community organizers. Some are working with government agencies and the healthcare sector, as academics, professors, researchers that teach and do different types of work in the university, service to the community. But I would say the theme that I think everyone shared across the different sectors was this focus and this drive to work with community, whether with community the sector where they were working, or in partnership with also local communities to address issues that were affecting local communities, whether it was violence prevention, whether it was youth empowerment, health equity. So community psychologists, they work in different settings, different environments, but they share this common drive to really push for social justice.
I like that. And I love the alignment with Charles R. Drew University. And it sounds a little bit similar, just like with the broadness of public health, right?
Yes.
Where it,
Absolutely.
there's so many synergies there. So, Dr. Chavez, I mean, being a community psychologist, it sounds great, but just thinking about the academic pathway, I mean, how How could someone be a community psychologist? Do you have to go to college? I mean, what does that pathway look like?
Yeah, I mean, there's different pathways. That was the other nice thing that we learned from doing the interviews with 31 community psychologists around the world, that they all had a different pathway. Some of them actually didn't start as psychologists, but they, were in public health. Then later they decided to pursue a PhD in community psychology. And so that's the other thing about community psychology, is very interdisciplinary. People are trained in different disciplines, but then later they learn about community psychology like I did and fall in love with it, because it provides the methods, the tools, the way of thinking that you might not see in other disciplines. And it gives you I think the opportunity to work more with community and partnership, right, in ways that addresses the complexity of the challenges facing community. But like, for example, at CDU, we do have our psychology program, and it has an emphasis in community counseling. It's a bachelor's of science. We don't have a master's or a PhD yet, right? Hopefully in the future, we can start a master's program or a PhD in community psychology. That would be one of my dreams to do that. But people can get the bachelor's of science in our program and then go on and get a master's in public health, an MPH, or go on and pursue a PhD in community psychology. And you do have various community psychology programs out there. Not as many as traditional PhD psychology or like clinical psychology programs, but they do exist. And people, if you do want to become, I guess, and go into, say, people get their PhD in community psychology and don't necessarily stay in academia. Like I said earlier, they go to nonprofit organizations. I have colleagues that have started their own community-based organizations where they are the director of the organization, and they work in developing programs, implementing programs, evaluation of programs, whether it's educational programs in schools or health programs with medical centers or community organizations. So definitely, I think at least at CDU you can pursue the bachelor's of science in psychology. I teach community psychology in our program. I'm in the process of developing a new course called cultural psychology, which I'll be integrating issues of social justice in that course, and then also developing a new course that's specifically called action research, which is focused on, will be teaching a lot about the methodology and community-based participatory research, youth participatory action research, different approaches, methods where you work in partnership with young people or community residents to address issues of concern to the community, and then develop, new resources, new opportunities, new programs. So, you could get that bachelor's and then move on and go on to graduate school. And then once you get your training, you can go into different settings, different in work environments, because in reality, we need more community psychologists to address, the issues of social injustices that exist in the world, right? And there's so many, so there's a great need.
Thank you for that. Thank you. And I was just thinking, when you were talking about at CDU, they can get the bachelor's of science in psychology and then get the master's degree in public health. So a student could essentially go to a community college, transfer to CDU, go into the psychology program, and then stay here and get a master's in public health, and your career is just like, it's right there. And then if they decide to go and get the doctorate, if they're a glutton for punishment like you and I, then they have that option, right?
Yes, definitely. Yeah, that could be one pathway, right? So yeah, PhD programs take a long time, right? As you know, Ashanti. So But that's definitely an opportunity that exists at CDU, right? Getting a bachelor's of science in psychology. We have a small psychology program. You would get a lot of attention from myself, from our other faculty in the psychology program, because our classes are small. We have the way that I structure my classes are similar to like a graduate program, right? It's like a seminar type where it's not just me lecturing, but also creating a space for conversation like we're having right now, you and I, because that's, I think, where the learning happens, where it's really, and as a community psychologist, it's really, one of my goals is to really learn from others, from the community. And that's how I become a better researcher. That's how I develop better ideas. And that is one of the other themes of community psychology, is community psychology that's, I think, distinct, maybe unique from other disciplines. It is really co-developing knowledge together. So, in our program, it's really about learning from your lived experience, from your perspectives, your ideas, and giving you that opportunity to, discuss and grow intellectually, and then move on, and potentially I get a master's in public health or master's in biomedical sciences, get additional training in another discipline, and then you have opportunities to do work in research, whether it's research that I'm working on in the community or with other faculty at CDU. There's a lot of research happening at CDU. There's a lot of projects going on in South Los Angeles where there's a need for more people that are passionate about issues of social justice, that want to make a difference in the community. So, students that I've mentored, go on and basically get involved in other projects addressing issues of health equity in some way in Los Angeles, as maybe they're, at the point of pursuing medical school, applying for medical school or for graduate school, but they're getting additional work experience already and applying some of the knowledge and theories that they've learned in our programs. And so, that's one way that you can end up becoming a community psychologist, or at least a person. Even if you don't become a community psychologist, you learn about the principles and the values of the field that can guide your work. So I for example, at CDU, if even though I'm like the lone community psychologist, right, there are other people at CDU like you, Ashanti, and other colleagues are doing work that reflects the principles of community psychology, which I forgot to say is really, explicitly, it talks about the principles and values that other disciplines might not say, these are our values and principles that guide our work. But in community psychology, is really about, social justice, diversity, equity, empowerment, thinking holistically, ecologically about how our environments affect us. It's about prevention, not just treatment of disease or pathology, but it's about prevention, and also strengths. It's not just about focusing on the problems, what's going wrong with you, but what's going well with you, and building on people's assets and strengths. So I realized that I left that. I wanted to emphasize that.
Yeah, of course, of course. Yeah, because it's all about strengths-based thinking, not deficit-based. So
Yeah,
you guys, especially when we're talking about communities of color, it's not about what we don't have, it's about what we do have. So I
exactly.
really appreciate that. And especially with the community based, when you were talking about involving the communities in your research, oftentimes an audience, yes, I'm going to go on a tangent. So oftentimes with universities, we parachute into communities of color. We have our multi-million-dollar grants. We're doing the research and then we leave. But what I love about CDU and what you talked about, Dr. Chavez, is including the community in the research so they have some kind of ownership as well. And I think that's key. And teaching our students about that, snaps to you.
Yeah, exactly. No, yeah, it is. There's one of my classes that I teach, right, is I often use the like a Native American saying that states, researchers, well, the perception of some indigenous communities about researchers or scientists is that, they're like mosquitoes. They suck your blood and leave. So um that's the perception, right? That not just within the indigenous community, but other communities, because of the history of what researchers, the approach, the work that they've done, that did not really involve the community in the process of developing like the research questions, conceptualizing the ideas, and not just waiting till the end, right? When researchers have are thinking about brainstorming what's important and what kind of questions they're interested in studying, but it's starting at the very beginning and having a conversation and understanding one another, learning from one another. That process of co-developing the knowledge together, right? It starts from just even, what are you thinking of at this moment, right? And then that dialogue blossoms to, something that maybe, you and I separately would not have been able to think about it, but then in dialogue, then, something new is born, right? So I think, right, like, yeah, students at CDU, whether it's in our psychology program or other programs, because of the mission and the focus of CDU is really to help, students develop, you know, building on their lived experience, and it's building on the strengths that students bring to the table, and then leveraging that, so then they continue growing as in their career, but as human beings too, right? That they want to make a difference, and the reason that they went into school, right, to most of the students really, they want to have a positive impact, right? They want to have a positive impact in their communities, and you can learn the tools and the concepts that can be helpful in doing that, right? Whether it's through writing about the stories of your community, whether it's about applying for grants that can give you funding, the money to be able to implement projects and do a research study, where you ultimately want to develop resources that are where there's gaps, right, of services, whether it's about mental health services that need to be improved, different things, right? So that I think a lot of students have a passion for wanting to really give back and make a positive impact. And I think at CDU, it could be that, great start where you get that opportunity and learn about what's already happening and start contributing. So a lot of students, I think, and that's also thinking of me as an undergrad, or my colleagues that went to other institutions, where, they might not have had those kinds of opportunities because, sometimes, other places, the classrooms or classes or students are a lot. Professors don't really get to interact, one-on-one with students. And there might be located in, places where you don't see these community-based projects that you see in South Los Angeles, right? Where, students are getting opportunities to get involved and contribute, and start learning about, the issues, not just from the textbooks and the theory, but by being a part of the projects that are happening in the community.
Excellent. I love it. So now we're going to shift gears. We're going to dive into the discipline and the topic of mental health. So, Dr. Chavez, can you tell us what is the difference between mental health and mental illness?
Great question, Ashanti. So mental health, I think, I like a definition from the World Health Organization that I often use in my classes, and which is similar to like the definition of health from the WHO, which really emphasizes that it's not just, for health, that's not just the absence of disease, but it's the presence of well-being or wellness, right? So for mental health, it's similar, that it's not just about thinking of the mental health symptoms or the pathology, the problem, but what is, how is your well-being, right? How are you doing? And also thinking of your potential, even if like not just of like how you are at this moment, but what you can grow into, right, in the future, your potential, your talents, again, your strengths, and then also the contribution to community. So that's another component of the definition of mental health from the WHO, is that how are you contributing to helping your community, helping others, supporting others. So you're sort of like your ability to be engaged in working with others, right? It's very communal. It's like a definition where it's not just focused on the individual level, that tends to be a dominant definition, more traditional way of that people think about mental health and mental illness as just maybe, our individual symptoms that we have. That's all part of it as well. Mental illness is, focused on, that part of the symptoms that you might have that's tied to anxiety or depression, stress, clinical diagnosis. So, if you've gone to see a mental health professional, you've been diagnosed with a mental illness, whether it's, depression or anxiety. But some people might, even with mental illness, not just think about it in the context of like the clinical context as, a clinical diagnosis, right? But it's a spectrum too. Some people think about it as a spectrum where you have health and well-being on one end of the spectrum, and all the way up to maybe like you're struggling with your well-being, emotional well-being, you're in crisis at another end of the spectrum. So there's different frameworks, there's different ways to think about mental health and mental illness. From a community psychology perspective, I would add, that it's really thinking about our environments, right? That, again, that's that ecological perspective of how do you understand mental health and well-being, that we cannot understand our mental well-being and health, even like mental illness, without really understanding your context. And a way to understand your context is by thinking of like the ecological model, which is like different levels. You have your microsystems, your family, your friends, if you're part of a church, your school, your community, your neighborhood, to the macro level, which is society, the world, the global context, and those factors that end up affecting our microsystems, which in turn then affect us as individuals, right? So, and then the other huge component is the social justice, that, the question, can we truly have mental health and well-being with so much injustice and oppression happening, right? A lot of problems are systemic and structural, and until we address these structural systemic issues, it's going to be difficult for us to be well, right? I mean, we can have moments of wellness, right, still within what's happening in the world, but from a community psychology perspective, what's really key is that we have healthy environments that foster mental health.
Yeah, you bring up a good point, and that leads me to like the next two questions. It actually falls into what you just said. So the first one is what factors impact our mental health, right? So we're just coming, well, COVID is still around, people, so mask up. So we're still going through this disease with COVID-19. but what other factors impact our mental health?
Yeah, so can I think from an ecological perspective, you can also think of the another model, which is, what I used in a health psychology class that I taught just this past semester. And that's the biopsychosocial model. That's similar, I guess, to the ecological model, that it's taking into account how our health, our well-being, our biology is interconnected with with our psychology, with our social context, and I would add with a cultural context, and not just this. So our social context is imbued with, cultural themes, and different cultures in our society. There's diversity, and there's different norms and traditions and beliefs and values, right? So I think you have to really, which is one of the reasons that I'm excited about teaching cultural psychology next semester. But it's, factors within thinking of this framework, whether it's the biopsychosocial model or the ecological model. It's that, from a biological perspective, of course, you have genetics. There is some research finding a connection between in some of our genetics and some mental illnesses. But then it's always in interaction with the environment. So it's really like epigenetics, which is what another growing field in, in medicine and biology is really, it's really the interaction. It's dynamic, right? It's not just one or the other. And then from the psychology side, it's like who you are, your identity, your personality, your self-esteem, values, your beliefs. All those are sort of factors. If you believe that you can get better, there's research in health psychology that that is associated with you then taking action and engaging in behaviors that are healthier for you, right? So that the psychology is important. And then the social aspect could be like the social support. Social support is, thinking back to health psychology, that's another huge factor in making a difference in our health. That if we have social support from community, from family, from others, that is super important for our not just psychological health, but our physical health as well. And like social support is connected to a reduction in risk of cancer, diabetes. It really buffers and protects you from diseases. So those are some other, there's factors at different levels that play a role. And then for the social, obviously, broader macro level, like issues of poverty, violence, housing, and food insecurity are, affect your ability to be able to put food on the table, to eat healthy, to have a home and a shelter, and protect, be safe, and all that in turn affects your mental health and your overall your health and your well-being in many ways. So there's just multiple factors, right, that affect our mental health, which is then I think the motivation to think about mental health more broadly, more holistically. And sometimes that we know that all these different factors are important, but yet in terms of the research and in terms of what people are doing, interestingly, not all the research in mental health reflects this holistic thinking, right? So that's where the field of community psychology is sort of pushing the rest of psychology or the rest of the mental health field to do that kind of work, where it's not just you're thinking about it, but what kind of actions are you taking to actually address these issues, to like do the research, but also like the advocacy and the activism part for prevention to not just treatment of mental illness, but for prevention of mental illness and promotion of well-being.
Yeah, the promotion of health, right? And our mental health is a part of our overall health. That was great. That was wonderful. It reminds me of the social determinants of health, right? So
Yeah.
with education being, one of the most important because it's linked to all of these other factors that greatly impact our health. So thank you for that. So, all right, you touched on this, but let's take a deeper dive, Dr. Chavez. So, the American Public Health Association stated that racism is a public health issue. And there's research that states that racism has a negative impact on mental health. So, can you talk a little bit more about how structural racism it impacts the mental health, not just of the recipients of it, like people of color, but even with our white brothers and sisters who are our allies, Can
Mhm.
you talk a little bit more about that?
Yeah, certainly. Like, I think, racism is just, a form of oppression that has existed for a long time, right? Our country is founded on, racist actions and policies and laws that to this day has shaped our society, right? And our neighborhoods, our communities, our institutions. We continue to see systemic racism um, manifest in our educational systems and our medical and healthcare systems. Um, so it just impacts us in so many different ways. I could, and organizations and institutions, fields have unfortunately contributed to, the structural racism in different ways, right? So it's important for us to reflect on that. And interestingly, and I believe it was 2021, where the American Psychiatric Association, the American Psychological Association, both, I think within the same year, a few months apart, um, they came out publicly acknowledging and apologizing for contributing to structural racism in the past. And these are organizations that have been in existence for over a century, right? And that was just 2 years ago that they, came up with a public statement. And I think it was not just, both APAs, the psychiatric and the psychological association, but it was other organizations that were coming out with similar statements, acknowledging and owning up to, their contributions to structural racism. And then, stating that they would okay.
So, what were you saying, Dr. Chavez, about structural racism and
Yeah.
different organizations that apologized?
Yes, I'm not sure exactly where I left off, but I was talking about the American Psychiatric Association, American Psychological Association, that were acknowledging about, their contribution to structural racism and really, indicating that they would take action to address that. Um, you know, the I think it was also thanks to you see more diversity now in the fields, right? Like, so you see you saw the people of color that were, basically in leadership positions and taking action. So I think that also made the difference that some of the colleagues that I have from the American Psychological Association were, working and doing research on these kinds of issues that were motivated, obviously, and know that it's so important that we're pushing, for these statements as well. So it's also thanks to the work of, the scholars and activists of color that were challenging organizations and institutions to be better, right? To recognize that this is a problem, a significant problem. That's like the root of the problem. I think when you talk about health disparities or inequities, you can't talk about it without really talking about issues of structural racism. But interestingly, a lot of people do in terms of research. There's been researchers that have done a review of research studies that are focused on health disparities or health equity. And they've found, for example, that a huge percentage of the studies never use the term racism, that they never like explicitly acknowledge that at the root is structural racism. So they sort of go around the problem, right, and talk about issues of disparities, but don't really go at like what is the root problem, root cause, right? And I think that's where we need a lot more work to be done, right? So where I see our next generation of students that are attending CityU that will come to our psychology program, that will become the new generation of community psychologists, right? That pushes to really do that important work of understanding like the different ways that racism impacts us, but we know that it's doing that, right? So now what kind of actions are we taking to change that? And that part that's the difficult part where, you know, and then I can tie it to, again, another way to think about community psychology that's opposed to compared like maybe other social scientific fields, that it's really about the action part, right? In other fields, people might be studying the phenomena or problems, but not really taking action to change, right? So that's the other, like the epistemology of community psychology, which is the philosophy of science of like understanding what knowledge is. And, what does that mean? Again, we co-develop it together with the community. And then you do that with the goal of change, of community change, of addressing the systemic oppression and problems that you see, like racism, right? So it's not just about doing the research, but taking action.
There you go. And that's key, taking action. So I just want to make sure that we respect time because we have some more. I mean, we are taking a deep dive, Dr. Chavez. So COVID-19 has devastated our society. We know that. I think we've lost 1 million lives due to COVID-19. And research has shown that since the pandemic, rates of depression have increased, especially in young people, right? We saw an increase in depression, substance misuse, domestic violence. So what assistance and even safeguards can be provided to our schools and universities to help students and even families who need assistance? And I'm speaking not just of, our students, like students in college, but also with our middle school students too. Can you talk more about that?
Yeah, I think there's definitely has been a rise in mental health challenges and stress, right? Even pre-pandemic, there had been an increase in mental health challenges, and that's tied to a lot of factors, right? And I think one of the other factors that I left off from, like this, when you think about the social dimension of the biopsychosocial model, or like thinking ecologically, it's like social media, right? Technology and our exposure to, misinformation, or exposure to a lot of stuff on the internet that in different ways impacts our mental health, right? And we have obviously, thinking of the concept of community, like new online communities that are formed and new ways that we can connect with each other. But there's also, ways that we've become disconnected from each other, right? And so it's kind of doing both, right? But maybe an opportunity to build new forms of community, but it's also has affected the way that we relate to each other in ways that, we used to, and we don't do it anymore. And it's interesting because, I think even pre-pandemic, levels of loneliness and isolation have been going up. And then after the pandemic, I think it exacerbated that. So I don't know if you were aware of the recent statement from the U.S. Surgeon General regarding loneliness. And loneliness is like a new public health epidemic. There's a rise of loneliness, and even stating that the effect of loneliness on our health is as bad as smoking 15 cigarettes a day. That is that harmful to our health, our physical and psychological health, right? So it's a lot of things happening. There's a lot of challenges to our well-being, right? And for our young people, right, it's living in a world where you see all these challenges happening, all these problems, and then climate change happening, right? There's an existential threat to, unfortunately, right, to our world, to us as humans. There's a challenge in terms of thinking of what does it mean to be human too, right? With artificial intelligence to AI, right? That is sort of threatening our just even our ability. Is it going to take away jobs? But it's also like redefining and kind of putting us in that position where like we have to think about like what does it really mean to be human? That makes us different from like our AI, right? And so young people are growing up, right, this generation, in a world where they're just being impacted and bombarded with different challenges, right? So it's not easy. I think one approach from a community psychology perspective is to really create those spaces where young people feel included, right? That they're part of the process of developing the approaches to helping support their mental health, right? I think definitely, of course, you still need the traditional forms of mental health services like psychotherapy. In some cases, situations, young people do need to be on medication, right? Depending on the severity of their mental illness. That's to sort of stabilize and address the symptoms, right? But you need to then tackle the root causes, root problems of why we see the mental illness and mental health challenges that we see. So I think, for example, I'm working with one of my partners, which is the Community Healing and Trauma Prevention Center, which is part of the MLK Junior Public Health Center, part of the Los Angeles County Department of Public Health, and it's located close to CDU, just like a block away. And I've been working with them since I started my faculty position at CDU. And the reason that they started this center, this initiative, was to address issues of complex trauma stemming from violence in the community, but also addressing issues of vicarious trauma. So healthcare professionals also might experience trauma from the patients that they serve, from the community members that they work with. And within the Healing Center, there's a lot of exciting programming and opportunities to engage the community, to build community, to build spaces that are more innovative, that are that social support that I talked about earlier. That is, social support is key to your overall health, and that destigmatizes mental illness, right? That's a significant problem with a lot of our communities. That, again, having a certain understanding of what it is, mental illness, but if you then create these spaces where it's about building community, and it's really community psychology in action, and which is a perfect opportunity for me to put into practice what I was trained to do as a community psychologist, is to then develop spaces and resources for young people to then tell us what is it that they need. So I'm working, for example, with one of the projects is developing a curriculum resources that is guided by Youth Participatory Action Research, YPAR, which is really engaging young people from early on at the stage of the process of research, to learn from them, like what's important in their lives, in their communities, in their schools, that they see like the factors. When you ask me what are the factors, right, that might impact mental health, your mental health, is like then asking them, like from their perspective, like what are the factors, and then addressing them, and then working with them to take action in some way, whether it's through advocacy, through the arts. That's another huge component of the Healing Center, that it's developing more arts-based approaches, painting, there's, music, they've had drumming circles. Now there's more, because of the pandemic, a lot of the programming, went virtual, and then now they're bringing back a lot of in-person, like workshops and spaces, support groups, and through these spaces, people connect with each other, like not in like using social media, but connect like physically, right? And then have conversations. When we did the 1-year evaluation of the center, one of the things we learned was that what was helpful is just people making friends and learning about each other, their neighbors and residents. And the Healing Center sort of provided that opportunity, that space to get to know each other and not feel, going back to, what the Surgeon General said, that we're facing an epidemic of people feeling alone, loneliness, right? So it's creating that, but having young people, like with their voices, be included in the process of understanding how can we best help you. Because in reality, if you think about it, we're never going to have enough mental health professionals to serve everyone that is experiencing mental health challenges, right? That's just, it's difficult. So you want to do, what you want to do is a lot of prevention, like when people are feeling stressed, so then it doesn't escalate to, people developing chronic anxiety or depression. You want to address it as early as possible. And yes, with middle school students, getting younger elementary school students, when, to really start early, because mental health, like people's, when they're first diagnosed with the clinical diagnosis, it starts at a young age. Most of like the first time that at some point, a lot of us are going to have mental health challenges. It's very common, right? And about 75% of people will experience, if they have a mental health challenge as an adult, they would have experienced it before they're 24. Like 75% of people will experience it when they're younger. So I think it's important to start early and have programs in schools and, or at CDU, in the community, where you have people that you ask them, what is it that they need?
Wow. That was great. That was great. I know we're coming up on time, but just one more. So I love when you talked about community psychology, and it's about bringing the community together to heal. There's just been so much hurt, there's so much divisiveness, so much division, right? Just in our society, especially in communities of color, even with fighting internally, with different groups, fighting each other. Dr. Chavez, how can we heal our community? How can we do that?
Yeah, that's a huge question, right? I don't know if I obviously I don't think I have the solution for that, but I think it's some of the things that we've been discussing, right? Definitely creating opportunities to build community. I think at the core, community psychology is really, the term that is emphasized is community, right? Is how do you build better communities where you don't see that divisiveness and people experiencing loneliness and feeling disconnected. But that's a challenge, right? How do you, when you have people that at the level of our society, of our country, which we're very divided politically, right? And we're seeing a lot of divisions, and we're seeing a lot of acts of, going back to your question of structural racism, where people are actively, like governments, banning books, right? They're written by certain authors that are about this race and, sexual orientation. And so you see a lot of people that are actively promoting things that are oppressive. And this makes it difficult, right, for a lot of communities to feel like they can feel well and feel safe, right? So it's difficult to heal in reality, right, in this context where you see a lot of problems. But I think knowing that you have other people close to you, like the micro system, micro context of the ecological model, with your family, your close friends, your church, your neighbors, where like the healing centers, creating those friendships in the community locally, where you start by changing the microsystems. And even like when I teach, right, try to create those spaces where it's a safe environment, or also courageous environment where you can speak up and share your voices and your perspectives, but in a way that you feel like you're not going to be harmed, right? It's going to help you process emotions, help you grow, right, too, and learn. But we need to really work together, right, to develop that support, because the healing process is very personal for everyone, I think, and it's difficult. It's not easy. And I think if one thing that I can say in my humble perspective is just that you need to provide that non-judgmental, like, support, where you're listening to others and really trying to be there for them, like, authentically, right? And in order to do that, you have to be vulnerable too. I think we do need to be vulnerable. And everyone, right? And us as researchers, so I'm currently actually working with some colleagues on writing a paper on vulnerability, applying youth participatory action research. Like, when we work with young people, as adults, if we expect young people to share about how they're feeling and to help them with their mental health, we also need to give that part ourselves, right? And be vulnerable and share about our journey, our experiences. So there has to be vulnerability in that process. And then we can heal in certain spaces. Like, then how do you tackle the broader macro level aspect? It's a little bit trickier and more difficult. It require a lot more people working together on that. But I think you can definitely promote healing at the micro level and creating those spaces, whether it's with your family, with friends, and I think that is critical.
Yeah. To quote RuPaul, if you can't love yourself, how in the hell can you love anybody else, right? If you don't like you, I mean, how can you like anybody else? So it starts internally with us. So yeah, I think that's key.
Mhm.
That's key. Sometimes you see people who hurt others, and then they said hurt people hurt others. Yeah.
Yeah,
So we
exactly.
really have to take
Mhm.
a real good look at ourselves. So,
Mhm.
Dr. Chavez, I just want to thank you for taking time out of your busy schedule to join us in the Lion's Den, our inaugural webinar series here at CDU. Are there any last remarks that you want to make?
Yeah, I'm honored. It's just a pleasure just having the conversation with you and sharing a little bit about my perspective and experiences in my field. And hopefully there was something that was, interesting or insightful that people can take, and right. But it's just, yeah, it's about really having this conversation like you and I are doing, right? Mental health is talking about it. It's not keeping it to yourself. And you're right, exactly right. It starts with yourself, with oneself, how you think about it. And I guess the last thing I could say about community psychology is really that when I was first exposed to it, really what I found out about it is really, it's how you think about the world, about the universe, right? As you think about it differently, it's about changing the paradigm. It's really changing yourself, right? And it starts with yourself, and then hopefully it can spread to others, in a positive way. But this is great. I enjoyed it, and happy. Thank you for inviting me.
Of course, anytime. So thank you so much, Dr. Chavez. And to all of you guys out there in Zoom land, Facebook land, YouTube land, thank you so much for joining us in the Lion's Den. And if you want more information about any of our programs, check us out at www.cdrewu.edu and follow us on Facebook, Instagram, and what else? Facebook, Instagram, and LinkedIn, you guys. Yes, yes, yes. Thanks, and see you next time. Have a powerful day, everybody. Bye.